When a brain surgeon removes a tumor, one question matters more than almost any other. Where does the tumor actually end? That sounds like something modern scans should answer, but in real brain surgery, it often isn't clear at all. And that matters because brain tumor surgery is a balancing act. The surgeon wants to remove as much of the tumor as possible, but they also want to protect the healthy brain around it. Take too little and the tumor is left behind. Take too much and the patient could lose important functions like speech or memory. So can artificial intelligence help with this problem? And can AI help neurosurgeons see tumor boundaries more clearly? When people imagine a brain tumor, they usually picture a round mass with a clean edge. But many tumors do not grow this way. The classic example is glioma. They often grow in an infiltrative pattern. That means tumor cells spread into surrounding brain tissue instead of staying in a clean round mass. So the border you see on a scan is not always the full border of a disease. Some tumor cells may spread beyond what seems obvious on MRI. At the same time, the tissue surrounding the tumor may be distorted by swelling, inflammation, or pressure from the mass. That makes interpretation difficult. For the surgeon, this creates a major problem. In glioma surgery, the goal is usually maximal safe resection. That means removing as much of the tumor as possible without causing unacceptable damage to the patient's brain. And this is easier said than done. If the tumor sits in the motor cortex or language areas, there's very little room for error in the surgery. So the question isn't just where is the tumor, it's also where do I have to stop? Before surgery, the team studies the patient's MRI in detail. The scan is then loaded into a neuronavigation system. You can think of neuronavigation as a kind of GPS for the brain. It helps the surgeon track where they are relative to the tumor and other structures. This is a huge advantage, but it also has limits. The biggest problem is that the brain doesn't fully stay still during the surgery. Once the skull has been opened, things begin to change. Cerebrospinal fluid is released, the tumor may be debulked. Tissue can shift because of gravity or surgical manipulation. This is called brain shift. And brain shift matters because it can make the original MRI less accurate as the operation goes on. That is one reason tumor borders remain difficult to define in operations. To improve accuracy, surgeons may use these tools. They help a lot, but none of them can help fully solve the border problem. When people hear AI in surgery, they usually imagine a robot doing the operation. That's not what this means. Here, AI refers to machine learning algorithms that can interpret and analyze images. Their job is to define the tumor borders more effectively. One of the biggest users is tumor segmentation. Segmentation means teaching the computer to outline the tumor on a scan. In other words, the system tries to label which parts of the image are likely tumor and which parts are normal tissue. This matters because brain tumor imaging can be complex. AI can probably process the information faster and more consistently. In theory, an AI system could help by outlining a tumor on MRI, estimating where some parts of the tumor may remain, and helping update the navigation as the brain shifts during surgery. That doesn't mean the AI is making decisions by itself. It might just become another layer of guidance. This is one of the biggest areas of research in AI and neurology. Researchers have trained deep learning models to segment gliomas on MRI. These systems can separate different tumor regions. That's useful before surgery, but the more interesting question is if AI can help us during the surgery. And that is much harder. Intraoperative imaging is messy. The quality may be lower than standard MRI. Ultrasound can add another challenge since it can be difficult to read, especially during an operation. So a model that works well on a clean preoperative image may struggle in the OR. Still, progress is being made. One of the most promising uses of AI is in updating the surgical map. The surgeon starts with a preoperative MRI, but as the operation moves forward, the brain shifts, and this reduces the navigation accuracy. AI may be able to help solve part of this problem by comparing the clean preoperative MRI scan with the new intraoperative imaging. It can then estimate how the anatomy has changed and help realign the navigation system. This sounds technical, but the idea is simple. The surgeon starts with one map, the brain changes shape during the surgery, and AI may help update the map. And that matters because late in the operation, when most of the visible tumor is already gone, the remaining question remains the hardest one. Is this tissue still tumor, or is it normal brain tissue that has been displaced and distorted? This is the kind of problem where better imaging analysis could help. AI is not a perfect detector of hidden tumor cells, and it definitely does not eliminate the need for functional mapping. There are also important limitations. Firstly, gliomas are biologically messy. The MRI border is not always the true microscopic border of the disease, so even a very good and advanced imaging model is still limited. Second, AI models rely on their training data. A system trained in one hospital might not work as well in a different hospital with different scanners. So the promise is real, but the evidence still needs to mature. The future is probably not a single AI tool doing one big thing. It's probably going to be a surgical workflow where multiple tools work together. A future brain tumor operation may look something like this. The pre-op MRI is segmented by AI before the operation begins. Functional topography and imaging are added to the surgical plan. Intraoperative ultrasound is analyzed in real time. Navigation is updated as the brain shifts, and the surgeon gets better information on where the tumor may still be. AI will not replace the neurosurgeon. It's going to function as a decision support system. So can AI tell a brain surgeon where a tumor ends? Not perfectly and not yet, but it may help more and more. And in glioma surgery, even a small improvement could matter. Brain tumor surgery has always been a balance between removing enough and preserving enough. AI will not remove that tension, but it's going to help the neurosurgeon navigate it with more precision. Germany is one of the leaders of the brain scanning industry. To learn more, you can watch our other video here.